So if a patient had symptoms that couldn't be resolved down at the lowest echelons and made it back to a concussion care center, of which there were 11 arrayed throughout Afghanistan while I was there, they would have the ability to be treated by specialists in traumatic brain injury who would help them, give them specific sleep tools to help them with their headache, to give them what we call a progressive return to activity following a concussion. They would help that service member get back into the fight. If they needed something higher than that and that they couldn't provide at that level, they would evacuate that patient back to an even higher level of care within theater, where things like neurocognitive assessment tests, just a fancy term for taking a look at how someone's memory, how their thinking really is following a concussion. I was in Afghanistan for a short period of time, and I had the luxury of inheriting 11 concussion care centers, which the services and the deployed medical providers, in conjunction with the leadership, created. And so that's a new entity, and it really proved its value. They were arrayed throughout the country. Occupational therapists and occupational therapy technologists were the ones who manned those clinics. They were able to provide close to the front care, because one of the things when anybody gets injured in combat, they want to stay close to where their buddies are. They don't want to be evacuated back, and that's been our experience. So if we could treat them as far forward and as early as possible, we'd have the best outcomes. And those concussive care centers had a return to duty rate greater than 90%, and that's a symptom-free, not based on time, but based on a programmed, stepwise approach to rest and reintegration with ever-increasing levels of activity.